Snoring during pregnancy is a fairly common condition, often due to hormonal changes. Estrogen and progesterone cause swelling of the mucous membranes in the nose, increased blood flow, and weight gain. Although usually not too dangerous, severe snoring or other symptoms can be a sign of sleep apnea, a more serious condition that can affect both mother and baby. Increased risk of preeclampsia, high blood pressure, gestational diabetes, and affect fetal development. Therefore, mothers need to change their sleeping position appropriately as recommended by the doctor, control their weight reasonably, keep their airways clear, change to a healthy lifestyle, and consult a doctor. Important note: always consult a doctor before applying any treatment, especially during pregnancy, to ensure absolute safety for both mother and baby.